and this is called the malleolus. If we find if we go from there posterior towards the back, towards the heel, back from there, then we can get the posterior tibialis pulse. And sometimes it's easier if the foot's a little bit flexed to be able to feel that. So the posterior tibialis is kind of deep. We can find it right. Put this here, and that way we can just soak the whole thing. And I don't have to be quite so careful if I'm doing that. I'm just going to put enough in here to let the whole thing absorb and soak in there and get nice and wet. So I've got enough. Skin, giving us the ability for the skin to move and to stretch, or elasticity as we would call it. The thing that I think is most important here is just to understand and kind of visualize this capillary bed and lymph flow coming off of that, and understand the importance of increasing lymph and white blood cell and innate immune system response to an area. Right, and then right next to it, kind of going underneath here, we have another one I really like. This is Anomopsis or Yerba Mansa, which is oftentimes used as a respiratory herb, but also for a lot of wound healing. I have a bunch of it growing back in there. I don't know if you can see that. A lot of Anomopsis back in there. In a field or post-disaster environment, sutures are generally not preferred, and staples are generally not preferred. We want to try to allow wounds to drain and close from the inside out. White is our ischemic, really is what we call macerated tissue. So in other words, way too much moisture. It's tissue that's, think of like for you herbalists in this class, think of a maceration tincture where you're taking your herbs, you're soaking them.